Hey, listen carefully. If you are over 60 and you keep waking up at 3 a.m. for no clear reason, this is not something you should ignore, because what feels like a small sleep disturbance could actually be your body trying to warn you about something deeper, something happening quietly in your heart or your blood pressure while you sleep. And the most concerning part is this: it often happens without pain, without any obvious signal, just a sudden awakening. Maybe your eyes open, your mind feels alert, your heart feels slightly different, and you cannot explain why. So let me ask you something. Has this happened to you recently? You go to bed feeling fine, but then you wake up in the middle of the night, around 2 a.m. or 3 a.m. Sometimes you feel a bit restless. Maybe your chest feels slightly tight. Maybe your breathing feels shallow. Or maybe nothing feels clearly wrong. Just a strange sense that your body is not fully at ease. If that sounds familiar, then what I am about to explain may change the way you think about your nights. Because waking up at 3 a.m. is not always random, especially after the age of 60. Your body follows a natural rhythm, and during the night, your blood pressure is supposed to drop, your heart rate is supposed to slow down, and your system enters a recovery phase. But when something interferes with that process, your body can react by waking you up, almost like an internal alarm system. And here's where it becomes important. One of the hidden reasons behind these awakenings can be related to fluctuations in blood pressure. In some people, instead of lowering smoothly during sleep, blood pressure may remain elevated or even spike. And this can create subtle stress on the cardiovascular system, enough to disrupt your sleep cycle. Now imagine this scenario. A man in his late 60s goes to bed after a normal evening, but during the night, his blood pressure does not settle the way it should. His body senses this imbalance, and around 3 a.m., he suddenly wakes up, not because of noise or discomfort, but because his internal system is reacting, trying to regain control. Or consider a woman in her 70s who experiences stress during the day. Maybe she carries that tension into the night. Her nervous system stays slightly activated, and instead of fully relaxing, her body remains in a light, alert state. And this can also lead to those early morning awakenings. And here's something most people never connect. Stress hormones like cortisol can rise at the wrong time during the night, especially if your body is under strain. And when that happens, your heart may respond. Your blood vessels may tighten slightly, and your brain becomes more alert, pulling you out of sleep. And over time, this pattern can affect not only your rest, but also your heart health, because your body is not getting the deep recovery it needs. Now you might be thinking, is this dangerous? Or is it just part of aging? And this is where clarity matters. Occasional waking can be normal, but repeated waking at the same time, especially around 3 a.m., can be a sign that your body is struggling to maintain balance during the night. And if this continues, it may increase strain on your cardiovascular system, particularly if it is linked to blood pressure or stress responses. So what can you do right now? The good news is that there are simple steps you can take that may help your body regain control. First, pay attention to what you do before bed. Avoid heavy meals late in the evening, because digestion can keep your system active when it should be resting. Second, create a calm transition into sleep. Reduce screen exposure, lower mental stimulation, and allow your nervous system to slow down. Even a few minutes of slow, controlled breathing before bed can help signal your body that it is time to relax. And if you do wake up at 3 a.m., here's something simple you can try immediately. Do not panic. Do not check your phone. Instead, focus on slow breathing. Inhale gently through your nose, hold briefly, and exhale slowly. This can help calm your heart rate and reduce internal tension, giving your body a chance to settle back into sleep. And over time, this simple response can reduce the impact of those awakenings. Now let me leave you with an important thought. Your body is always communicating with you, especially at night, when there are no distractions. And if it keeps waking you up at the same time, it may be asking for attention, not in a dramatic way, but in a quiet, consistent signal. And the earlier you understand these signals, the more control you have over your health, especially after 60. Because small patterns, repeated over time, can lead to bigger outcomes. And recognizing them early gives you the opportunity to respond before they become serious. So tonight, if you wake up again at 3 a.m., Do not ignore it. Listen to your body, stay calm, and support it in the simplest way possible. Because sometimes the smallest adjustments can make the biggest difference. Sources include the American Heart Association, which emphasizes the importance of nighttime blood pressure patterns for heart health, and the Sleep Foundation, which explains how sleep cycles and stress responses can affect early morning awakenings.